Yep, I can
Yeah,
hear you.
yeah,
Can you
it's
hear
good.
me?
It's good.
Awesome.
Sorry for the trouble, man. Sorry.
No, you're fine. It's always a fun experience trying to figure out how the heck Instagram works.
How's everything over there?
It's good. It's good. Yeah, we're I don't know what time it is for you guys here, but it's in the morning here, about 9 o'clock in the morning. So it's good. It's definitely it's been an interesting year. Got a lot of cool things happening for me and the athletes I train, and just professionally with some of the chiropractic work we're doing. But it's good overall. It's always good to have things to do and be busy,
Good,
right?
good to hear that. Here
Mm.
we are like 9 in the evening. Yeah.
Oh, that's not bad then.
Thanks
Okay.
for answering my invitation, man. I know you're busy.
No, that's fine. That's totally fine. Yeah, I remember when I was over there teaching, um, it, it was always, I had to figure out what time of the year it was, because sometimes it was 12 hours, I think, ahead, or 13 hours. So like it used to be really easy to
Yeah.
convert over to Eastern time, but it makes it a little difficult sometimes, but that's all
We
right.
came here like 2 or 3 times, right?
Yeah, we did RPR seminars there. I want to say in 2018, 2000, and then two in 2019, I think is what ended up happening. Or maybe we did one in 2018 right away in the year, and I think late 2018 and then mid 2019 or something of that nature. We were in the process of figuring out the fourth trip for 2020, and then obviously with COVID
Yeah.
and everything that happened, we just really haven't gotten back to it. But I guess everyone's kind of taking a bite of that crap sandwich, but it is what it is, and you find a way to
Yeah,
move
man.
forward.
I was looking for the course you're coming back to like 2020, and COVID happened. So
Yeah,
yeah.
we'll get back though. It'll happen. We'll just figure it out.
So I know there's a lot of coaches in Taiwan already know who you are, but still, can you introduce yourself for the coaches in Taiwan?
Sure. Yeah, absolutely. So my name is Tyrel Detweiler. I am a chiropractor. So doctor of chiropractic over here in the United States. I can't remember if you guys even have chiropractors there as far as a legal, like a legal profession, but so we work kind of in various forms, but in my realm as a chiropractor, I focus more on athletes and active individuals, people that want to take care of their body, stay healthy, stay in shape, all that stuff. So that's kind of where my professional background comes from. I played football at the University of Iowa. So football, collegiate athletics are a big kind of background as well for me. I was the team chiropractor for the University of Memphis for 3 years as well. And then now I've moved since in 2018, moved here to Columbus, Ohio now. And I operate a practice, hybrid performance and wellness. And then I have another business that I do some private coaching and strength training, athlete development for offensive linemen. So kind of getting back to my roots with football. So yeah, that's kind of my background. I taught for RPR all the way up until 2020 when all this happened. I don't think we had a seminar since then. So from 2018 or 2017 to the end of 2019, I took the very first RPR seminar back in 2016, and then started using that in my doctoral practice with the athletes I was working with at the University of Memphis. And we had a lot of really, really cool results with a lot of different, issues with motor control, motor patterns that we were trying to fix, but then also even just injuries, strains or just weird injuries that just wouldn't go away. So it was a really cool tool to add to my tool belt, and that's kind of where I dove kind of head in towards that direction of understanding the body through the lens of the nervous system. So that's kind of a broad, background of my last 10
Cool.
years.
Except for like RPR, do you do other like education?
Not formally as far as for like a certification course, but one of the cool things with, so we're actually building a brand new facility here in Columbus, and we are kind of trying to bring the healthcare facility in with, performance and with strength training, all that. And so one of the aspects of it, we're going to have about 1,500 square foot of turf, that I want to also utilize as for space for seminars. So we'll start bringing in seminars to our facility. We'll do some dry needling seminars. We'll do some strength coach seminars. We have a really good collaboration of strength coaches in the area that are really, really good at what they do and have a lot of knowledge. So Columbus is kind of a hot spot for strength. So trying to build that opportunity for more people to come and learn and to build on themselves. But yeah, currently I don't teach for any other certification courses, but I think down the road, it's probably something I'll be getting into, just doing my own type continuing education courses, even if it's not, NSCA certified type thing. I'll probably start doing that at some point here in the next 5 years.
That's cool, man.
Mm-hmm.
So today I want to at the beginning, I want to focus on the RPR stuff. Okay.
Absolutely. So, sure. What do you got
first
for
of
me?
all, I know there's a lot of coaches who took the RPR courses, but still there's a lot of strength coach who took it, but COVID happened. Yeah.
Sure.
So for those who haven't had the chance to know what is RPR, can you tell us what is RPR and why, and how do you use it?
Sure, absolutely. So pretty simply put, RPR is a system of self-application drills, so things you can do on your own, to stimulate your own body and your own nervous system to essentially normalize balance and function in the nervous system, which when you do that, what you'll see is a kind of return to a balanced and normal state in your body, which translates into movement is where we really start. But as you get deeper and deeper into RPR, what's really cool is it becomes, everything. It becomes anxiety from a test that you're taking. It becomes, a tool to better help you, prepare for a job interview, or just, some people with insomnia have a lot of benefits from something like an RPR. So it's really a way of helping others learn how to, start doing these self-maintenance, these self-activation drills on their own body, and help their nervous system kind of return to a more normal and balanced state. And when you do that, then you pretty much, you take care of function in the whole rest of the body, right? So the nervous system's king. And when we pay attention to our nervous system and we really make sure it has the tools it needs to work properly, then you're going to be in a situation where you see a lot of cool things happen in the body because that governing system is working optimally. So we teach people in RPR how to do an assessment to understand what's going on with the body, how it's moving, how it's creating motor patterns, and then an easy use kind of self-implemented tool set, which is basically your own hands that you can do to basically rub certain stimulation points in your body, and that actually helps the nervous system reduce stress and get to that more balanced state. So that's kind of what we teach in the course. It's really cool, and it's something that it's one of those things whenever someone says can you explain RPR to someone, and I'm sure you've had this issue too when you're trying to explain what is RPR to someone. It's one of those things you almost just have to experience, because it's so hard to explain to someone how you can go from your perceptual state right now, which is normal, whatever's going on in my body right now, that's normal, and then all of a sudden you do a couple tests, you start doing a couple breathing drills, and you hit a stimulation point on your own body by yourself, and all of a sudden we retest and you're stronger or you have more flexibility. It's an instant change, right? And then you get up and you go walk around, or you do a squat and you're like, oh my gosh, I feel really good. It's hard to explain to someone what that that shift is like, because it's your nervous system, it's your brain's current perception of where your body's at. So one of the big things we do in RPR too is we teach you a bunch of these tools, we teach you a bunch of these tests and a system of being able to objectively figure out, like, where is my body at right now? Then you know from there where you're going, right? So that's kind of what we do in the course, but it's kind of really cool, right? It's hard to explain to someone that the whole, like, I thought I was strong and all of a sudden I'm weak in this test, but then I do this breathing drill, this wake up drill, I rub my sternum and all of a sudden I'm freaking rock solid and my squat goes up.
So is it kind of like breathing, kind of, or like, like maybe sometimes turn off the parasympathetic?
Sure. Yeah, you're really close. So basically, it's a system of breathing and self-maintenance tools that we utilize to help balance our nervous system. So what that means is you have think of like your body as this is like balance, right? And then if I go over to this edge, I bring the needle to this edge, this might be a stress response. This is sympathetic, right? That's your fight or flight response. That's the, bear in the woods, or maybe for you guys over in the eastern part of the world, it's, the lion in the jungle, right? And when you run across that lion in the jungle, boom, your nervous system is going to go into this fight or flight state. And that's a totally normal and totally natural accommodation that your body has, a response your body has to stress, because it wants you to get away from that tiger, right? The other end of it would be like parasympathetic. That would be your rest and digest is typically what we talk about there. That's when you feel, you eat a meal and you feel heavy afterwards. You just feel like, oh, like I'm just tired. And it's those two are there to have a specific function in the body. Like, we can't always pin the needle over here on go. Sometimes we have to allow our body to recover, to rejuvenate, especially in the strength world, right? That's recovery is essentially parasympathetic, right? And so what ends up happening is we get into a state where, we don't really run across a tiger anymore all day long, but what we do run across are other stresses. We run across not being able to sleep enough. We run across the strains of society, having to excel and succeed, sitting all day long. I mean, at least in the Western world, we sit a ton, right? So all those are still the same stress that your body then has to respond to. And as we become more chronically stressed, that needle shifts, right? And when it shifts into that state, we're spending way more time being in a stress state than we ever are in a relaxed state, which then signifies to the body, hey, not only am I, threatened, is my environment threatened, it's happening all the time. I don't know when this is going to end, right? It's not like there's a tiger here and either I'm going to run away from this thing or I'm going to kill this thing or it's going to kill me, right? That's a very small point in time where your body has to worry about that. So as this happens, right, you start getting into this more of a stress state. You start having adrenal fatigue. You start having all different kinds of health problems because of an overstressed state. So really what RPR is doing is it's helping give you like a window into seeing the state of your nervous system, and then these breathing and self-maintenance drills to help start to bring that needle back into a more balanced state. That's probably the easiest way to understand it, and it really makes a difference.
I experienced once. I didn't take the course, but one of my friends did, and there's one time he's trying to explain it to me, and what we did is like we did a crunch test for like my abs, and at the beginning I was like weak, and then he just rubbed my inner thigh right after it, and I was like so strong, and I felt like it was like so amazing. It was like magic, man. So I know, sorry.
Which is, it's just kind of cool. Like your first response is going to be it's magic. Like, what the heck just happened? But that's the cool thing about the nervous system is the nervous system's now. Like when you do something to your nervous system, it's an immediate response. So that's kind of cool because you can kind of in your mind justify or understand like, okay, it has to be a neural response. I didn't strength train a muscle, right? Something changed in the brain. Something changed in my neural response, and all of a sudden they recruited this muscle group for this movement a lot better.
Yeah. So I know there's like 3 regions that you're gonna rub or like slap or something like, right? So how do you find the like if I want to like just like what I did, if I want to like enhance the app, you're gonna rub the inner thigh, and if you want to enhance like the hip flexor, there's a point right like 45 degree under the I forgot the name. So how
the psoas, the belly button, the psoas.
How do you like find those like regions?
Sure. So just to clarify, are you asking where those regions came from, or are you asking how you locate them?
Where the regions came from? How do they find it?
Sure. So RPR it's kind of, if you think about science, science is really just it's just a big copy fest of like piggybacking off of other people's work. So it's not as if that, RPR came up with these points and found these points and all this stuff. RPR is actually a branch of another system, which I think has been to Taiwan before, called Be Activated. And so Be Activated was established by a guy in South Africa named Douglas Heel. And so essentially the story of RPR is that, a bunch of the people that took Be Activated looked at kind of how that system was set up and looked at where there would be an opportunity to kind of be able to simplify the system to make it easier for like anyone to use on themselves. Because normally you had to kind of be at like a practitioner level to kind of get how Be Activated worked. So it's kind of been filtered down to that standpoint. So the points that we then do are directly pulled from Be Activated, and then in general just kind of trial and error as well. But the Be Activated points are actually they originate from what are called Chapman reflex points, and Chapman reflex points were discovered. Or you call not really invented, discovered back in the early 1900s by a doctor of osteopathy in the United States, Dr. Chapman. I don't remember his first name. And what he noticed is there were specific areas in the body that had nodules underneath the skin, and these little nodules are kind of like marbles or tough spots, however you want to think about that. But almost there's something tough underneath the skin that had kind of like a nodular nature to, and they'd be tender. And if you rubbed into these spots and rubbed into them and worked through this tenderness, you saw actually changes that would occur in the organ health, right? So originally it was utilized for things like a spleen or a liver, or kind of getting more into your acupuncture, Chinese medicine type thought process of we stimulate a point here, we get a response in the system like here. And yes, right. And so that was like an early understanding of it. So the origination were Chapman reflex points, and then kind of as this all progressed, the points themselves are only a piece of the entire system, but the points themselves came from essentially you go from, and this is just basic, what happens in science is you go from, well, it works for, helping someone get over, I don't know, some sort of, maybe a spleen issue or a kidney issue or like a stomach issue, gallbladder issue. I wonder if we use this and like kind of played around with this for maybe if there's a muscle component of this. And this, if I'm getting too out there, let me know. But there's a thing that happens in the body. There's reflexes that occur within the nervous system that can be of multiple different reflexes. So they have what's called somatovisceral reflexes, which is if I affect this muscle, or if I affect this muscular tissue or this neural tissue, or this fascial tissue, I have a visceral response, and visceral meaning organs, right? So it's a somatovisceral reflex. I rub here, there's a visceral response. you can have what's called a visceral somatic response. That's when, like, people, talk about when you have a heart attack, your heart is actually being, it's being ischemic, right? It's losing blood flow. There's a blockage, and yet your whole left arm is painful. There's nothing going on in the arm, but your nervous system, as it's kind of interpreting what's going on, says, well, we don't really ever get any signals of pain from the heart, so this must be coming from the arm. And so you have a viscerosomatic reflex. So when it comes to looking at why the Chapman reflex points work, you're looking at what's a somatosomatic reflex, in that I rub here and there's a muscular neural output that occurs when I rub in those areas. So that's kind of the background of, like, what those Chapman reflex points come from, why they work. And really, like I said, it's kind of just, some of these things are trial and error. One of the cool things I'll say is a lot of this comes back to a lot of acupuncture and acupressure points. And I by no means am an acupuncturist, but I have taken about 100 hours worth of education in acupuncture. And when you really start to try to wrap your mind around acupuncture and why acupuncture works, you're talking about a system that's been going on for thousands and thousands of years. There was no medical knowledge back then. There was really only, trial and error. What happens if we do this? What happens? And then that trial and error now becomes a result. And out of all these trials, you have one result, and you go, I wonder if I do that on the next person, if we get the same result. And so over time, you build this huge platform of healing people based on just consistent results. And that in and of itself is science. So that's kind of the cool thing, is I kind of come back on and I think about acupuncture and how amazing acupuncture is and how much that actually works. I use kind of a westernized version of it as dry needling. And if you talk to a real acupuncturist, they're saying you're doing acupuncture, you just don't really know what you're doing, which I agree with. I totally agree with. So it's kind of like that, right? It's at some point we found these points relate to the body, and if we stimulate this area, if it's tender, if it's hard, as you breathe through it, it softens up, and holy crap, we get a huge change in how the body moves over here, and it's a really cool thing. So that's kind of the background, to basically get your mind a little bit more around the
it's cool, man.
points.
It's really cool. And it's interesting that I think not just like RPR or like dry needling or anything else. I think even like strength training, or like what we did is like enhanced performance. It's also like trial and error. Not really everything is followed by the like literature, or like everything is done by the lab. Yeah, we really have to do those, like try and know what is best for our athletes.
Correct. And to lean on that even more, and I think it's just I think it's kind of a culmination of, like, if you hear the story of like the first generation builds it, or the first generation starts it, the second generation builds it, and by the time it gets to the third generation, they have no idea what's going on. That's kind of feel like how we are in medicine right now, and just in science. It's like, we have this push for, evidence-based medicine or evidence-based practice and all this stuff. And originally, like, evidence-based practice is positioned on three pillars of how you actually accomplish that, right? So the first pillar would be the experiences and the knowledge of the practitioner, or in strength training, it'd be the strength coach, right? And the second pillar is going to be the experiences and the expectations of the person you're working with, right? So the patient, the client, all that stuff. So what knowledge base do I have as a practitioner, as a strength coach? What are the expectations and results and experiences of the person I'm working with? And then finally, you have what the clinical evidence says, what the current evidence says. And that's a very strong foundation for practicing the art of health, the art of medicine, the art of strength training, if you rely on all three. And what I think has happened too much is we've gone and shifted to that pillar of, well, what does a paper say? What does a lab tell me? And I don't want to think about it. I don't want to actually use my mind. I'm scared of being wrong, or whatever it might be. I don't want to do the work. I want to know now. So a lot of people in evidence-based medicine now say they're evidence-based, but all they do is they sit around and wait for everyone else to do the work for them. And then they go, oh, well, look at me, I know what I'm doing. The way evidence works is, you first have to have that first result, that question, that, I wonder if we do this based on our knowledge now, what if we did this, what happens to the body, or what happens to someone's strength? And then you have to try it. You have to do the trial and error, like you talked about. You have to do that for a while and get enough results for finally, and then from the from the business side of things, when you have big pharma or big medicine, big whatever in it, then you have to have someone that's actually willing to fund you to then do the research, to then maybe 10, 15 years later go, oh, look, it turns out this method works. And everyone else, the people who actually started it, are sitting around going like, yeah, no shit, we've been doing it for 10 years now. Like, we already knew that, So, and then not to say science is bad. It does help confirm and make sure we're on the right track, but the science that people think about, the evidence, the literature, the paper that says what you're doing is right, that doesn't come right away. That comes after the fact. So they're getting the cart before the horse.
That's so true, man. That's the main reason I'm doing this, because the coaches in Thailand, they're like literally like everything they do, they're gonna wait for the like research. And what this is what I heard from Coach Boo from LSU. He said is like strength coaches or performance coaches should be pioneers. They should be ahead of the research like 20 or 30 years. So basically why I do this is because I want the coaches to think and to really try whatever they want to do. And if they did was like right, or if they did whatever they did like enhance their performance, I think that's good.
Yeah, I agree. And when they don't quite know why something happened, but they can see a result, to not shy away from that experience, to kind of lean into their curiosity, right? So if we're doing a strength test, an ab test, right? And a curious mind that's open to learning, that wants to grow, will experience that ab test, right? Where the first time I do an ab test, okay, I'm weak, and then I just do one little thing to my body, and all of a sudden I'm strong. The curious mind will look at that and go, I want to know why that happened, because I know something changed and something significant just occurred. I don't know what happened. It's a little scary, but I want to find out. The closed mind, the person who isn't really open to learning, is going to look at that and go, ooh, that's like voodoo. I don't know what that's about. That scares me. I don't, that's placebo effect, or I don't, that's, they won't look any further into it. It very well could be completely full of crap, sure, but the curious mind is open to looking at that, and to kind of exploring more and doing some investigating to figure out if it is crap, because it doesn't always. I would agree that it may be a trick, it may be fake science, it may be whatever, but you don't know until you kind of give your body the ability to go in and think about it, to think critically, to compare, to make those analyses, and then make a decision. That's what real art of practice is. It's not, hoping that someone else can do it all for you, so you don't have
just
to take
like human
risk.
Body, like hundreds of years ago, that we don't really know if human body works this way. Yeah.
Right.
Thanks, man. I'm gonna jump in the next question, okay? So, I know a chiropractor, and I want to know about like low back pain. So, if the person come with you with low back pain, is there like assessment you're gonna do, or like what would you do to reduce their pain, or like are you gonna like gain their hip mobility, or like thoracic mobility, or like maybe just teach them how to like breathe?
So this was a component of my practice that obviously is important, right? As a chiropractor, you work on the spine a lot. You work on the joints, muscle, nerve, all that stuff, right? That's kind of where we have our expertise. And originally, like as I started out as a practitioner, working with athletes or working with people. Like lower back pain is what I'm going to see. And I felt confident in understanding lower back pain and kind of being able to, weed my way through it. But one of the things I kept finding was like, I would work on someone, they would leave my office feeling good. And the next time I saw them, they say it felt good. And then 10 hours later, 12 hours later, a day later, whatever it was, it started coming back. And so that to me was like, well, you're doing something right, but you're missing something, right? So kind of feeding back from the RPR standpoint, that's about when I took RPR. And my thought was there has to be something neural here, because I was always kind of skeptical about, what we really knew about motor patterns and how we really knew, like, okay, is it someone's, like their glutes just weak? Okay, well, how do we know that? Like, I know my glutes might be weak, but I don't know really. I've been doing clamshells for how many years now? My glutes haven't gotten any better, right? So it's like, I wasn't quite sure. There was something there. There was a disconnect. And when we talked about like firing patterns and how your body decides how to, fire in what sequence, that's something I just didn't really have much experience on. So insert RPR, and I start getting a little bit better image of like, oh, okay, if we're firing from a right sequence and we can test that, now we can start finding more out about back pain. So all that to say, when I look at back pain, lower back pain specifically, any condition I look at, I'm trying to separate in categories what's going on with the body. So I'm trying to figure out, first and foremost, is this a functional problem or is this a structural problem? A functional problem would be, hey, this person is overactive in their lower back, they're overutilizing their lumbar spine, or their hip flexor isn't firing correctly, it's pulling on the front of the spine, or they're not breathing correctly. The sequence of how they create movement is off. And I know that when that sequence is off, now all of a sudden we have an issue with stability now in the various joints of the body as we're producing force. So for example, when we walk, when we jump, when we squat, when we bend over to grab something, when we get up from a chair, we're producing force throughout the entire body. It's not an isolated joint, and therefore it can't be isolated to a single muscle functionally, right? So if I'm standing up from a chair, I have to push through the ground, through my legs, my lower back, everything has to move, and therefore every joint that has a degree of freedom of movement now has to be stabilized in order to produce that force up the chain. If I change how the body moves and fires those motor patterns to control those muscles, now I'm creating dysfunctional patterns that can create instability in certain joints. So when I see a lower back pain patient, the first thing I have to wonder is their lower back hurting because they're just taking on way too much force, or force is being lost into that joint when they're moving, when they're lifting, when they're doing their daily activities. That's a functional issue. So I take them through essentially the RPR level 2 evaluation, and I find out how are their hip flexors firing. Are they firing in a, we call it 1, 2, 3 state, where it's, starting with the hip flexor and then working outward in the body. And then, if that's happening, all right, cool. Then I'm going to move, and I know it's not a functional issue. I just determined whether it was or not. Then I move to structural. If it is a functional issue, then we go into RPR, we go into be activated, we do all that stuff on them. From a structural standpoint, now you're talking about, is there a disc that's been herniated? Is there a nerve that's being pinched, right? The best way to understand a structural problem is we can go on an MRI, an X-ray, et cetera, and we can see a structural issue with the body. That's what I mean by structural. So I kind of determine back and forth between them. That's the way I find out. And then as far as why does lower back pain happen? Unless you're in like a car accident, or you're someone that, fell off a roof or had some sort of traumatic incident, even when you're lifting in the gym, if someone gets hurt lifting in the gym, unless you're talking about someone who just used complete awful technique, most lower back injuries are going to be that chronic repetitive use, repetitive strain movement. So that causes that back pain. So it's not that all of a sudden you had back pain, and most people will say, like, I don't know what I did, all of a sudden just started hurting, and it never went away. It's all the things you're doing in your life, how you're sitting, how you're going to sleep at night, how you're standing up, how you're bending down to pick up weight, because you're not really spending much time in the gym in comparison to your whole life. So that's where we have to start looking at everything that they're doing. So one of the people that I've kind of leaned on for understanding how to analyze that a little more would be Stuart McGill's work. He does a whole certification, but just books in general on the lower back and how the lower back kind of slowly builds strain and wear and tear and becomes painful. So that's kind of where I kind of look at the body. Is I first want to know what's going on. Is this something that's structural? Because when it is structural, it'll take a lot longer. When it's functional, it'll be a lot quicker. Then once I have that piece of the puzzle figured out, I now need to know how they move, how they bend, how they go to bed at night, how they get up from a chair. Because if they're lazy about how they move their body around, they're putting excessive force, excessive strain into the body, and we have to stop that. So unfortunately, most people's back pain is their own fault. But they just don't know, right? They don't know. So a lot of what we have to do if you're a strength coach working with someone, and if you're within those lines of where you can practice with helping someone, you can absolutely be the advocate to teach them how to move, how to pick up an object, how to value standing up with their purse the same way they value standing up with the bar when you're doing a deadlift. Like those have to be there, because if not, you're not really taking the stress out of the equation, and you don't really know why back pain might be happening. So a lot of people, you'd be surprised, you change how they move and you make sure they're doing things properly, bracing properly, bending properly. A lot of people will have a positive response from that.
From the answer you just gave me, you use RPR like kind of like a corrective exercise, right? So
yes. Think of it as corrective exercise for what you can't control. You can't control the way your motor patterns fire. That's not a conscious thing. So it's corrective exercise for that.
So, and it works long term, right? That was so cool, man.
Mm-hmm. It does. Yeah. And the big thing about it is I like it too, because it starts to push responsibility onto your clients, because it does work, but it works when you reinforce it. So that's why they can do this on their own, but they have to do it on their own. They can't just come into you, have you do it once with them, and then expect it to work. It's just like if they want to get stronger, they can't come into the gym, expect to do one workout with you and have results. They have to keep the consistency. However, once they've developed that consistency, it does last, and they do feel healthier, they do get stronger, all that.
It's kind of just like how fascia works. Yeah.
Mm-hmm.
So last thing would be like spine mobility and spinal health. Spine mobility and stability. Mobility versus stability and spine health. So like how much mobility should we have, and like how much stability should we be working on? And how and like how or what should we work for, like letting our spine to be more healthier?
So to unpack that a little bit, when it comes to movement, or when it comes to, let's say joint function, right? Because mobility is an expression of joint function, stability is an expression of joint function. It's my view that you have to establish stability first before you can have mobility, or before you should work on mobility. So for example, you can take it to the extreme, right? So if we look at stability as the joint's ability to maintain the articulation between joint surfaces, right? That's essentially what stability is, right? To be able to maintain it through a range as needed at any given point in a range of motion. Mobility would then be, your ability to move through a range of motion, right? So potentially the ultimate mobility would be something like the shoulder. Okay. So to kind of understand this more, we know the most mobile joint in the body is the shoulder, right? But it's also the most unstable joint. Okay. So how does an unstable joint obtain such stability or such mobility? It obtains such mobility because of all the muscles and all the neurological function that's involved in that joint to help stabilize that humeral head against the glenoid while you're going through a range of motion. So if you were to say that, and there's a debate here, like what do you work on first, right? Mobility or stability? I always say stability, because if you take away stability in the shoulder joint and then try to move through a range of motion, mobility, right? If it's unstable, now you're harming that joint. You're putting force into that joint. So that's kind of a starting point of how you should kind of start to view the joints and view the body. Another example, right, is, in order to squat, you need to stabilize the body first to start the squat. You wouldn't tell someone at the start of the squat just to be all nice and loose, and then as you're going to the bottom to start to try to stabilize, right? It's just that's a really good analogy to use. So when it comes to the spine, it doesn't change. And actually the spine itself it's kind of a mix of mobility and stability in it, right? And then you can look at it however you want, in that maybe the lumbar spine's stable and the T-spine's mobile and, all that stuff. But really the way I look at it is each individual joint then needs to be considered too. And again, you need to stabilize those joints before you can mobilize them. One of the reasons that you find, and this kind of goes back to RPR and analyzing the body, one of the reasons that you find that mobility is a problem in the spine is because that muscle group or that area in the spine is now trying to compensate and create stability for an area that doesn't have it. So, for example, you can have a really tight lat, right, which feeds into the lower back, which is kind of part of that structure on the spine. You can have a really tight lat that might be causing some shoulder issues, but the reason it's tight could be because there's an issue of stability at the hip, right? And so that's kind of, you get into myofascial meridians, and you can play that game all day long. But I want people to understand that before they see someone and they say, you don't have the requisite, let's say, spinal mobility, so we're just going to start doing mobility, right? You need to kind of wonder, is this area tight and restrictive because it's trying to help out somewhere else? So that's kind of the first kind of thought process here. Stability always comes first. If you're not getting mobility somewhere, look to see if there's not stability happening elsewhere. So if let's say you watch someone squat and you think they don't have any T-spine mobility, like they're hunched over, well, go look at the hips. Go look at other areas in the body and see, is it possible that if we work on stability elsewhere, if their knees are caving or whatever it might be, play around with it, and that might give you a better indication of what's really going on with the body. It's very tricky, but in general, if we're just talking for general health, what are things that people can do to help, keep spinal mobility up and all that, like maintenance spinal mobility. I really like things like your cat-cow. Like it's a great just movement just to open up the spine and just milk the spine. There's a thing called imbibition that occurs when you move, and that's, so your discs, right, the spaces between your vertebrae, those are hydrated and they have water in them, and so there's no actual arteries that pump blood into those discs. They kind of have to rely on movement to create that. So we have imbibition, which is when we walk or when we move through a range of motion in our spine, we actually have a pumping mechanism that's an imbibition that actually pushes water in and out of the spine. So things like a cat-cow are creating imbibition in the spine. It's not loading the spine, so now we're not having an issue of you're trying to move through ranges of motion but not really focusing on stability, and therefore then you hurt yourself. Machines like a reverse hyper, I don't know if you guys have many of those over there, but reverse hypers are amazing for that, because now you're distracting the spine while moving it through a range of motion. One of the things I also like are even just simply like hanging ab raises. So if you're hanging from ab straps and you're doing like a knees to elbows, that's, if you look at the person from behind, right, they're going up like this, but their back's actually rounding, right? Their back's actually rounding as they come up. So that's actually creating kind of a flexion moment and pulling the spine apart while not being under load, again, because they're hanging, right? So all those are really good. I think I think in your programming, if you think of this from a strength coach aspect, if you're programming, if you're concerned about mobility and you're concerned about spinal health, put that stuff into your programming. So like I said, you can do an ab raise, like a hanging ab raise, to build the abs, but you can do it you can do an ab movement in a way that helps spinal health, right? You can do things that, kind of perpetuate that better positioning. In general, the best spinal mobility is to actually be mobile, to move, right? If you sit all day long, it doesn't matter what you're going to do outside of that spinal mobility wise. You're hunched over, you're locked forward like this all day long. You're hunched over. You have to be mobile, go move. You know what I mean? That's the best way to eliminate that, is not spending years in the same position. From a stability standpoint, I think that, again, I think you rely on the training. I think you really teach people to understand how to breathe and brace and squeeze their glutes and utilize their glutes in any movement, and you'll start to have a lot better stability in the spine. Stability is easy if we have proper motor function, right? Proper motor control. And then also if we're cueing it. So stability is kind of easier to do, which is why I would start with that. And then as you move through and you're stronger, you can move through bigger ranges of motion, all that stuff. But yeah, I would load the spine. I love loading the spine. I think that's healthy for it. Now you just don't want to load it too often. You have to give it time to rest and heal. But you load the spine, you load it often, you build that bone density up, you build that resiliency up in the body. And then, you do some mobility stuff outside of it, but it doesn't have to be anything extravagant. It's just get the work in, right? But foundationally, we have to have stability before mobility.
That's good, man. I love it. So that would be the last question I have for today. And finally, can you tell everybody about your future? Like what you're going to do in the future, and education-wise, and your personal training and your facility?
Sure. So we've been working on building a new facility here since the start of the year, around like April or March area. So that should be done here in about a month. And so what the vision is for that facility is to kind of be like a one-stop shop for people's health. So like in chiropractic, we focus a lot on, helping people out of pain and stuff like that. But the real key to health is to protect it, right? Is to invest in it and to try to build yourself up to a point where you don't have to be unhealthy, right? You don't have to be out of shape or hurt or deconditioned or, what may have you. So what we're trying to do with this new facility is essentially kind of look at the process of someone's healthcare journey as like a big picture, right? Maybe someone comes into me because they hurt themselves in the gym, and we need to correct that. But then there may be other things they don't realize that were attributable to that. Stress is a huge component of injury. In fact, there's studies that show that the rate of injury goes up when you have like collegiate athletes in finals week, right? During finals week, injury rates go up. Why? Because they're more stressed, they're sleeping less, they're maybe not eating as much, drinking as much. So stress is a huge component of that. So a lot of times we'll have someone come in and they hurt themselves in the gym, and the answer all the time is stress, because you can still have a physical stress, right? Physical, mental, emotional, neurological, chemical, all that stuff is stress, and the body handles it in the same way. But getting them to understand the big picture of how their body is functioning in the world and what they can do to maintain better health is a huge deal. So we start out there. We're gonna address those issues there. We're trying to kind of push a different model of care than what's traditionally seen. Usually you see like a per visit model. You come in, you pay for a visit, you leave. You have to come in another time, you pay for the visit, you leave. And I think that kind of sows a little distrust, because I think it becomes monetary driven. It becomes, do I really want to pull out my wallet and pay for another visit? I don't want to do that. I want to look at the result. So what we're trying to do is move people towards results-based care, where instead of worrying about paying for whatever visit they need to come in for, it's more about we're going to have a one price fixed cost, and that cost is for us to get you the result you need. So whether it takes me 5 visits, 10 visits, 20 visits, you're covered over that entire year worth of care. And I think that really helps out. So then from there, you're going to have access to a gym. So we're going to have 1,000 square foot gym and then 1,500 square foot of turf. So we have plenty of room to kind of get out and, help them, learn how to squat correctly if that's something that we need to do, fix form, or just provide a location for people to have the equipment they need to be able to do the things that they need to do to keep their body healthy. So we'll probably offer some programming there as far as strength programming, nutritional programming. We probably will dive in a little bit on functional medicine and start looking at blood labs and stuff like that, because there are indicators there. So that's kind of the healthcare side of it, and we're going to try to just create a community where people come to that office because they want to get better, and the reason they're at the office is whatever reason it is that they need to be there for that day to get that accomplished. It might be a visit with me, or it might be there just to train, Then on the other side of that, I do still have the offensive line training that I do. So we're about to start the football season here, so I'm a little bit backed off a bit, but that's going to be kind of my hub spot. So I have all in one. I have both my businesses in one place. So we'll train offensive linemen, athletes during the off season. We'll work them out during the in season, work on skill sets, work on blocking techniques, all that stuff. And then during the season, we kind of sit back and enjoy the fruits of their hard work and see them perform and see them do a good job. And we'll do a little film work too, but that's kind of going to be home base for all those things. So we're looking at probably bringing in a chiropractor here sometime soon, hopefully sometime soon, and bringing in some strength coaches to work in the facility and start taking on personal training clients. Just let them run with it, let them help people, for those that need a little bit more personalized care, personalized training. And then that's the ticket. I think we're going to push really hard for that in the next, for the next 5 years, really put our head down and try to build that up. Obviously from the teaching standpoint, I'm always wanting to teach, and I'm always wanting to stay active in the instructing realm. So as soon as COVID is more allowing for that, then I'll be back on the circuit and hopefully trying to teach for whomever will have me. And then, like I said, we'll be doing some seminars and learning and continuing education there as well, which will be a good networking opportunity to kind of meet new people and kind of find like-minded people and kind of put heads together.
Man. Cool. After COVID, maybe I will invite you to Taiwan.
Yeah, there you go.
Yeah, man.
That'd be awesome.
I know a friend of Justin. Do you remember him? I think he translated the RPR, right?
Yeah, Justin's awesome.
So maybe after COVID, we can invite you here back to Taiwan.
There you go. Awesome. Well, my wife came last time and we loved it. I mean, that was probably one of the better trips we've had. Yeah, got to see some dolphins, got to swim with some turtles. You don't get to see that in the middle of the United States and freaking Ohio. So that was pretty good stuff.
Sorry for taking so much time.
No, you're
Thank
good.
you, man. Appreciate it. I think it really helped.
Yep. Thank you. Hope people get some good information, and feel free to reach out for any questions if you have them.
Thanks. See you.
Awesome. See ya.
So that's all for today.